Hi, I'm Femi OK, and you're in the stream. Today, you can ask us anything. We have assembled a team of doctors to answer your coronavirus questions. To tweet us at ajstream or leave a comment in a live YouTube chat and tell us what you want to know. While doctors warn things will get worse before they get better, governments around the world are stepping up efforts to tackle this global pandemic. We all have questions, and joining us to answer them in Washington, D.C., Dr. Sarah Kureshi. She's a family medicine doctor. In New Haven, Connecticut, preventive medicine physician and lecturer at Yale School of Public Health, Dr. James Hamblin. And in France, Dr. David Nabarro. He's at one of the World Health Organization's COVID-19 special envoys. Hello, doctors. Good to have you here. I just want to remind our audience how the coronavirus spreads. So have a look here on my laptop, and we will start in Wuhan, China, and then just look at the cases tick up at the bottom of the screen, spreading and spreading and spreading around the world, which means that we now have a pandemic and masses and masses of questions. So I'm going to get straight into it here. Okay, doctors, for how long can the virus survive outside of its host? That's what Mohammed would love to know. Dr. James Hamblin, do you want to take that one to start off?
Sure. We're learning more about this every day. It's a new pathogen to our understanding. So the best answer to that is that it depends on the surface that it lands on, and that there are some surfaces where it can't live very long at all, and so we're talking about a matter of a couple hours. And then in other places, it seems to live longer. We're not exactly sure, so I hesitate to give an upper limit, but I have heard quoted frequently a couple days is a safe presumption. So if you're thinking about needing to go into the apartment of someone who was recently sick, if they haven't been there for a week, you shouldn't have to worry. But when you're in a crowded public space, many of which are empty now, but if you have to go out, I would assume that high touch areas assume they've been touched within the last 2 hours and that they have the virus on them, and behave accordingly. And that's the safest way to think about that right now.
How do you behave accordingly? Because I found myself trying to turn off light switch with my elbows and push the door with my hands in my pockets. And what would you suggest? I mean, this is your area, public health. How do we negotiate the world now?
I wish that I had a really unique solution to that, but the things you've been hearing about hand washing, hand sanitizer, staying home as much as possible, and avoiding touching things when it's not necessary, that is the best practice. And so, I really wouldn't worry too much about the number of hours or days.
All right.
Yeah, just be precautious. Assume it's there.
David, I'm on a website that you are helping to keep updated and writing great advice on. This is the WHO, this is the Emergencies Diseases Novel Coronavirus 2019 website. And there's a section here about protecting yourself, country and technical guidance. This idea of negotiating the world, what are you telling citizens around the world that they need to do?
Well, thank you. The most important requirement is for people who've got any kind of symptoms of a respiratory illness, but particularly high fever and dry cough, pain in the chest and shortness of breath, to really keep away from other people and to stay ideally at home, isolating themselves. Although the virus is transmitted on surfaces, as James just said, the far and away the most important means of transmission is through droplets that come out of our mouths and noses when we cough, when we sneeze, even when we talk. And what we know is that those droplets do not travel more than 2 meters. So we advise people all the time to keep 2 meters away from somebody who's got symptoms, and then they should be pretty well safe.
Is 2 meters the same as 3 feet? Because I've heard 3 feet and I've heard 6 feet. So 2 meters is what? This
and it's interesting, isn't it, how advice varies. But here it goes like this. If you're 3 feet or 1 meter away from somebody, that's pretty safe. But to be really 100% safe, we stay 2 meters away. We do not think that this virus is actually traveling in the air long distances, though, as James just said, this is a new virus, and we keep finding out new things. And there are a few reports that suggest that in some places it can go a bit further, particularly when there is no ventilation and closed air conditioning without a filter. And that's why we've had some issues with people who've been on ships where it seems as though they've been infected when they've stayed in their rooms and kept away from others.
Dr. Sarah Kureshi. Sarah, can I put this question to you? This is from Sade. Can the virus be inhaled through a cotton or polyester mask?
I want to answer that. Can I add on one thing to
please add on
to the last question? I just want to say one of the best pieces of advice that I read or heard was somebody saying, don't pretend as if you're trying not to get it. Pretend as if you already have it and you're trying not to pass it on to somebody else, because you can be asymptomatic and still spread it to others, even before you start to get the high fever or the cough. So just in terms of social distancing, just to be aware of that. Regarding the mask, the droplet size, it's very small, so it can go through. Just like if you're just using like a piece of cloth or something, it can go through that. The surgical masks that are used or that have been recommended by the CDC, it's been quite controversial, and I'm glad you brought up this topic, are at least in the U.S., and I'd love to hear thoughts from internationally, but our healthcare workers are not protective. They're not protected. They do not have the proper personal protective equipment. If you look at images from China, from Italy, from other countries, South Korea, you'll see they're wearing something called an N95 mask, which I know it's right now we're finding out new things, and we're not saying it's airborne, but if you're doing procedures in clinic that can aerosolize the virus, it can pass through those regular surgical masks. So an N95 mask is something that you're fitted for, and it's different. We have a major shortage of those in our country and around the world, but our healthcare personnel do not have enough. They're reusing them. They're not protected.
Okay. All right, doctors, this is from YouTube. YouTube is watching you right now. Nitrocorn says, should we carry hand sanitizer with us while travelling? Are they necessary, or will water and soap be enough? Who wants to take that one? James, you take that one.
Well, I personally, James.
Traveling. I think generally most travel is not advised right now. So if there are circumstances in which it is necessary, depending on where you are in the world, if it's possible to carry hand sanitizer, I would do that and use it very frequently and not touch anything and stay far away from people, physically distant from people. And certainly just do not travel if you are experiencing any of those symptoms that we've mentioned.
David, what were you going to say? Go ahead.
I just always try to have hand sanitizer with me. The best thing is to wash your hands thoroughly with soap and water frequently. I try to link it to when I take off my coat or put my coat on. Secondly, if you can't wash your hands, if you're, for example, in a place where there's no water, then it's really useful to have hand sanitizer. And not everybody who's watching this program will have running water in their homes. And if they can get the hand sanitizer, it's so helpful to have as a backup.
One of the things that's been happening is that our international audience around the world, they are coming in contact with the coronavirus, and their health authorities are telling them different bits of information, and they are confused. For instance, Tara, she reached out to us at the stream, and she told us this on Instagram. So she works at the London School of Economics, so that's in the UK, and the shop until yesterday was still open, with students coming to the shop, buying non-essential hoodies every day. The staff are travelling in on public transport every day and still not being told if we get paid if we close. And then there's a help us. And then today she gave us this update. Let's have a listen.
So in follow-up, they finally announced at work that they will close the LSE shop after tomorrow for at least 2 weeks, and we will get full pay until at least the end of term. It's a relief, but it should not have taken this long. Honestly, we're all just relieved at this point, but there are questions as to why it took so long to happen.
David, why is it taking so long?
I see governments trying to work out how best they can ensure their people are safe, whilst at the same time doing what they can to sustain economic and social activity. And each government around the world is trying to balance between different ways of going about things. Of course, as a public health person, I've been encouraging governments to be robust and rapid in their efforts to contain and suppress outbreaks. And so I would urge everybody to err on the side of caution. The only difficulty is that these kinds of activities like closing shops and reducing transport have a huge impact on people's lives and even can make it difficult for health workers to get to where they need to practice. So I'm really appreciating that it takes a little bit of time for governments to work out what to do, but I'm pleased to see more and more governments are helping the public to maintain physical distance of the kind that's needed.
So James and Sarah, as you're both in the United States, I'm going to give this one to you from YouTube. This is Sterling Van Buren. And he says, do you think North America is acting quickly enough to reduce the spread of the virus? Sarah, you start.
We're behind. We are clearly very behind, and we did have months there, so that's disappointing. But I think we're finally doing what we needed to do weeks ago, and we are doing it now, and I'm glad to see that. There are places where there's not social distancing. The beaches in Florida, there's a video the other day showing people still gathered together, hundreds of people. So there are places where that's not happening, but I'm hearing and seeing more and more that, especially messaging we're hearing from the government, has finally presented it as a pandemic and is letting the public know this is what you need to do. Stay at home, avoid any unessential travel. Do not go to the doctor if you have mild symptoms. Stay home and quarantine yourself, because our healthcare workers are getting overwhelmed, and it's a way for you to spread it to somebody else. If you just go, you have a mild cough and you go see your doctor, call your doctor first. So I think these messages are getting out, and we're starting to do the right thing. Where we are failing right now is, I'm going to keep bringing this up because I'm in touch with hundreds of physicians, thousands from across the country, and the healthcare workers do not have the proper protective equipment, and it's not just a risk to the healthcare worker, but it's a risk to the patients that they're seeing. And that is where we really need to step that up. Would we send soldiers to war without bulletproof vests and just have them wear cardboard? You know, the CDC put out a thing saying you can put a bandana if because there's such a shortage in this country of masks. We need to step that up. That's where I think we should focus our efforts.
James?
Yeah, I am thinking about supporting healthcare workers as similar to supporting soldiers during a time of war, in that we are going to be seriously tested. We're already rationing care by canceling elective surgeries and telling people to stay home with mild symptoms, when ideally we would like to be able to ask everyone to be evaluated and seen and make sure. And it's probably safe to stay home. I'm not saying it's not, but we have to be judicious in thinking about the overall picture right now, because we don't have those masks, and we are having other personnel issues, like that nurses and doctors may have to stay home to take care of children because schools are canceled, and may have sick family members who need to be attended to. And there are all these other issues which really threaten our personnel. And if they start getting sick or don't have proper protection, that will lead to serious shortages where people don't want to come in and go to work because they don't feel safe doing it.
All right.
So that we'll need everyone needs to think about the ways they can support that the healthcare workers right now.
Can I come in quickly just with a global picture on this one?
Sure, David, go ahead.
I love that.
This virus, is an unseen and really terrible enemy for humanity. But at the same time, the World Health Organization is reminding us that we can beat it. And we've seen countries beat it back and beat it back successfully. But it's up to us. And even if we're late, we should still be taking it really seriously, because if we let it go and just say this outbreak needs to affect everybody and we'll just live with it, the consequences will be extraordinary, not just for countries in Europe or the United States, but there will then be an amazing distribution from Europe and the US to other parts of the world where their health services are so much less well developed. We talk about health workers having problems with supplies and equipment in the United States or Europe, and we've got some terrible reports from northern Italy about this. Yeah. But just imagine what it's going to be like when it reaches Nigeria, when it reaches Bangladesh.
David, just take a pause for a moment, because it's almost like you've read our online community's minds. So we shared something on Twitter. So we talked about the US struggling to launch their testing for the coronavirus.
Mm-hmm. Yes.
Do you have access to test kits in your community? That is what we asked our international audience. Just scooting down here, very simply, Nigeria doesn't. What would happen in that situation, David? What's the worst case scenario?
The World Health Organization maintains that successful combating of these outbreaks of COVID when they spring up does require testing, because you need to be able to identify people and make certain that they know they've got to get isolated.
Right.
Now, if you haven't got tests, it is still possible to suppress, but you have to have a high index of suspicion, and it will mean isolating some people who don't have COVID, but better do that than basically say that we just are going to let the outbreaks advance and cause terrible suffering.
Okay.
So please do listen to WHO, those of you who are from countries where testing is not easily available, because the WHO can help you with how you should act if you haven't got a test but still feel that you need to be able to work to help people with COVID to isolate themselves.
All right, so I'm going to do this as a speed round so that we get as many more questions in. YouTube is moving thick and fast. Joseph Erg says, Sarah, I'm going to give this to you. What risks do pregnant women run?
So, this is a new virus. We only have 4 months of study, and luckily we are getting some data from China. We don't have enough, it's insufficient data to say, we don't have enough data to really know.
So we don't have enough data is the fast answer, yeah?
Is the fast answer, but I will just say, pregnant women, that your body's taking on a large toll. Sure. You can be a little bit, your immune system can be down. So take precautionary measures more than usual, and obviously that would mean hand washing and social distancing and isolating and all of those things.
All right, I don't mean to push you, doctors, but there's so many people wanting your advice. Pinky Abassi, how to check the flu. Pinky is on YouTube right now. Thanks, Pinky. How to check the flu and cough is just normal or seasonal, or it's a corona symptom? Please answer this.
This depends on where you are and the capacity for testing in that area and the burden currently on the healthcare system. So there'll be some places that will be able to say, yeah, come on by and we can check you out if you're concerned. And there'll be many other places where we say we only can have people coming if you experience these more concerning symptoms like shortness of breath or chest tightness and high fever and exposure to someone who was sick, and these other criteria that we would need to would suggest a higher likelihood of coronavirus.
Can I throw in one quick comment to that?
Go ahead.
But again, we only have reports of what we're seeing out of China, but it seemed like in the adult population, there was not as much co-infection with flu and COVID-19, although here in the U.S., the numbers are starting to look like it might be a little higher, but in the pediatric population, it was 40% co-infection with COVID-19, influenza, RSV. So just to be aware, just because you have one, it doesn't necessarily mean you can't have the other.
Do you know, doctors, what is so obvious that wherever you are in the world, there is not enough information about this new virus. Let me give you one example. This is Sudhanshu, who reached out to us on Twitter just a few hours ago. He talks about India being shut down for the international flights, and Sudhanshu is an Indian student in North America, and he's been quarantined because his brother's boss is testing positive and my brother's showing symptoms, so he's in quarantine right now. But he has set up his own helpline to offer help to other North American Indian-based students because no one was helping them. Their government wasn't giving them information and they were stuck. Let's have a listen to what he did.
There is so much confusion because of the lack of information accessible and available to Indian students. There are over 250,000 Indian students at any given year in the United States. And now, with the university shutting down, They won't have a place to stay. They won't have food to get. They won't have family members to reach out to, nor they might not have health insurance. Right now, Indian students aren't getting any information from their consulates or their embassies because they've shut down miscellaneous operations, only available through call or email.
David, just very briefly, what do you make of the citizens around the world rallying and being able to cope with a global pandemic that we haven't seen for very many years?
Because of the way you said that question, I can answer precisely. This is going to be an issue that requires people to be organized everywhere. You can't rely just on health services. The speed at which it advances means that it just overwhelms the health facilities so quickly. I so appreciate what the colleague is doing with this amazing system for informing people. Do use the World Health Organization as your base source of information. And if you want to get the most up-to-date details, do look at the report of the World Health Organization Visit to China that was completed on the 24th of February. It's on the website, you can download it, and it conveys many of the issues that we have the best knowledge about.
This one I'm going to give to you, James, and any information that we give out today, I am going to tweet it out. The ajstream will tweet it out from our Twitter account, so you get the hotlines and all the information you need, so you've got one place to go. This is from Steve Liu. He is on Twitter, and he says that there's a claim that a vaccine for COVID-19 has been discovered. How true can that be? And if it's true, how long before the vaccine is out there and made available? James, this is obviously something that you would be researching for your work.
That's a great question because the vaccine is going to be crucial to us getting past this disease. But every expert that I've spoken to says 12 to 18 months. So it is true that there are prototypes that have been discovered at unprecedented rates because we can now use sequencing technologies to do things we couldn't before. But the testing process, we just need to be very careful that it's safe and effective, which requires testing in increasingly large groups of people. And that just takes time to make sure that it's not causing any harm or making anything worse. So it's going to be a while.
Before we wrap up, I want to go to Celine Delay. She is a South African who is based very close to Wuhan in China, and she's been under lockdown for 60 days, 2 months. And many of us are just starting that entire process. And how are you coping? She sent us some advice for other people watching. Let's have a listen to Sindile.
Hello. Granted, it's been 61 days, but I still don't know all the answers. But I have a few things figured out to help you get by. First things first, when you wash your hands, clock in those 20 seconds. Make sure everybody all right, and maybe accompany it with a little bit of hand sanitizer of your choice. And when you decide to go shopping, shop for what you need and not what you want. And you do need some vitamins, whether it's your mama's prescription, your own prescription, or your doctor's prescription. Just overdose on those vitamins, all right? Read a book, pick up a hobby. You'll surprise yourself at how talented you are.
All right, she's making lemonade out of lemons, that's for sure. Sarah, you understand what it's like to actually have to keep yourself away from the general population because you have a little girl who had a liver transplant and she can't be hanging out in the park with other people because she has to be very careful. In a sentence, one piece of advice, if you're stuck indoors, what do you do? What's your best piece of advice?
Use this time to spread love, even if it's indoors with your family. Reconnect via FaceTime, via Zoom, whichever method. This is a time. And the other part is reconnect with nature. We say stuck indoors, but there's no limit to going outdoors. You can go in your backyard, go for a hike, anywhere where there's not other people. Just reconnect. I think that this is the time for us to look inward and do that.
It's been wonderful being in the company of 3 doctors answering your questions on the stream. We appreciate you. Dr. Sarah Kureshi, Dr. James Hamblin, and Dr. David Nabarro. All of the information will be on @JStream. Thanks for watching, everybody. See you next time.